Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Men aged 65 with localized low-risk prostate cancer may fare better if they are followed closely rather than treated immediately, according to research published in the Journal of the American Medical Association. Here's some information about prostate cancer. It is the most commonly occurring cancer in men. In its early stages, it often is symptomless, which makes screening for the disease important. It usually starts showing up in men aged 40 and older. Researchers from Dana-Farber Cancer Institute, Harvard Medical School, used a simulation model to create a hypothetical group of 65-year-old men newly diagnosed with localized, low-risk prostate cancer. They then used the model to estimate how well these men would fare if they were treated with brachytherapy, radiation therapy, surgical removal of the prostate, or active surveillance. Active surveillance consisted of close monitoring with serial PSA measurements, digital rectal examinations, and biopsies. Treatment was started if the disease progressed or when the patient chose treatment. To determine how the men fared, the investigators used an assessment technique known as quality-adjusted life years, or QALY, which takes into account both how long the men lived and how high their quality of life is while they remained alive. QALY was highest for the men who underwent active surveillance, followed by brachytherapy, radiation, and finally surgery. Even when the risk of dying from prostate cancer was substantially higher among those who underwent active surveillance, QALYs remained higher for this option. However, QALYs was heavily dependent on individual patient preferences, meaning active surveillance was only beneficial for those patients who were comfortable going this route. Today's research suggests that active surveillance could be a good option for early-stage, low-risk prostate cancer among older men who are comfortable with the option. For Insider Medicine in Depth, I'm Dr. Susan Sharma.